Welcome to our YouTube class on nosocomial infections. Nosocomial infections, also known as healthcare-associated infections or hospital-acquired infections, are infections that patients acquire during the course of receiving treatment for other conditions within a healthcare setting, such as a hospital or clinic. These infections were not present or incubating at the time of admission. Common nosocomial infections. Urinary tract infections. Often caused by catheterization, UTIs are among the most common nosocomial infections. Surgical site infections. These occur at the site of surgery and can range from superficial infections to more severe cases involving organs or implanted materials. Pneumonia. Ventilator-associated pneumonia is a significant concern in intubated patients. Bloodstream infections. These can occur due to central line catheters and are particularly dangerous because they can lead to sepsis. Gastrointestinal infections. Clostridium difficile is a common cause of severe gastrointestinal infections in hospitalized patients, often linked to antibiotic use. Causes and risk factors. Nosocomial infections are caused by bacteria, viruses, fungi, and parasites. Some common pathogens include Staphylococcus aureus, Escherichia coli, Pseudomonas aeruginosa, and Candida species. Patients with weakened immune systems, such as the elderly, newborns, and those with chronic illnesses, are at higher risk. Use of catheters, ventilators, or surgical procedures increases the risk of infection. Overuse or inappropriate use of antibiotics can lead to antibiotic-resistant infections. The longer a patient stays in the hospital, the higher the risk of acquiring an infection. Transmission. Nosocomial infections can be transmitted through various means. Direct contact. Person-to-person contact, such as touching, can spread infections. Indirect contact. Contaminated surfaces, medical instruments, or clothing can transmit pathogens. Airborne. Droplets from coughing or sneezing can spread respiratory infections. Vector-borne. Infections can also be transmitted by vectors like insects, though this is less common in modern healthcare settings. Prevention. Proper and frequent hand washing by healthcare workers is the most effective way to prevent the spread of infections. Sterilizing medical equipment and maintaining a clean environment are critical. Gloves, gowns, masks, and other protective gear help reduce the risk of transmission. Careful use of antibiotics to prevent the development of resistant strains. Regular monitoring of infection rates in healthcare settings to identify and control outbreaks. Vaccination of both healthcare workers and patients can prevent certain infections. Isolating patients with contagious infections to prevent the spread to others. Challenges in control. Antibiotic resistance. The rise of multi-drug-resistant organisms, such as MRSA, complicates treatment. Asymptomatic carriers. Healthcare workers or patients who carry and spread pathogens without showing symptoms. Resource limitations. In some settings, there may be insufficient resources for adequate infection control measures. Patient population. Increased numbers of immunocompromised and elderly patients in healthcare settings pose additional challenges. Impact. Nosocomial infections have significant implications. These infections can lead to severe illness and even death. Infected patients may require longer treatment, increasing healthcare costs. Additional treatments, extended stays, and infection control measures lead to higher healthcare expenses. Patients and their families may experience increased stress and anxiety due to nosocomial infections. Nosocomial infections remain a critical concern in healthcare settings. Preventing them requires vigilance, strict adherence to hygiene protocols, and continuous education of healthcare workers and patients. With the growing threat of antibiotic resistance, the importance of robust infection control measures cannot be overstated. Thank you for watching. Please like, share, and subscribe to our channel for more informative videos.